Regarding post-stroke care for a patient with large spasticity in their upper limb, the work carried out on IVS enables the patients to rebuild their body image and to relax the muscles that are spastic. The aim is to avoid having the patient focusing their attention on the spastic limb while the therapist is working on it. Indeed, when the therapist usually manipulates the spastic limb, the patient will look at their hand or fingers and protective reflexes occur. On IVS-3, an opening hand or arm movement is shown on the screen, so the passive motion induced by the therapist behind the screen is closely linked to what the patient can see and feel. This virtuous circle helps the patients relax their joints and stay relaxed longer. To illustrate this case, I suggest you watch the care session of a patient who had a stroke approximately 13 years ago. He retains a strong spasticity, especially around his thumb, his wrist, a bit less around his fingers, and a lot around his elbow flexor muscles. The session design must primarily be built from the distal to the proximal joints. This kind of approach makes it easier to release muscle tone on fingers and then move on to more proximal joints. For the first sessions, feel free to record analytic movements like opening fingers, for instance. When movements are recorded, focus on staying in the maximal opening position for a few seconds and to not go back to flexion. During session, first invite the patient to only watch the movement and to not perform any exertion, even if it may be tempting. Then grasp their finger and hand smoothly to manipulate and relax muscle tone. Your mobilization must be in coherence with the motion shown on the screen. So start manipulation when the fingers are about to open and hold the pressure in an opening movement during all the range of motion. You can feel muscle tone decreasing. Finally, if you feel relaxation is at a good enough level, try to place the hand and arm in a comfortable position on the table. Regarding spastic patients, we are aiming at muscle relaxation both to improve comfort and quality of life, but also as a previous objective level before promoting motor recovery. To ensure the lasting effect of muscle relaxation, it is important the patient repeats this kind of workout even mentally. IVS-3 sessions allow patients to repeat mental routines on their own to modify their body awareness and achieve more relaxed hand and arm positions in daily life.
Et de retrouver une position plus naturelle de la main afin de retrouver cette position relâchée au quotidien.
Outside of sessions, patients can mentally repeat this routine just by closing their eyes to maintain benefits over time.
Afin de maintenir les effets dans le temps.